Have you been injured in a car accident and you have headaches and you're wondering, what do I do next? This is a very common question, and we're going to explore this topic very briefly. Hi, my name is Dr. Matthew Collins. I'm a chiropractor. I am board certified in rehabilitation and I'm fellowship trained in primary spine care. Please remember, these videos are for informational and educational purposes only. They are not a substitute for medical or chiropractic advice, for diagnosis, or for treatment. So let's jump into this topic. Following a motor vehicle crash, headaches are a very, very common symptom that patients deal with, and they want to get them under control, and it's understandable. So, where do you go? Well, the first thing to remember is you need to see somebody who is trained to identify the type of headache that you have, and to identify that type of headache gives you the right diagnosis, which then gives you the right type of treatment. Common structures that are injured in a motor vehicle crash that can give you headaches are the brain. You can actually have a brain injury. You can have a vascular injury. You can have damage to the skull, to the bone. You can even have damage to the cervical spine. That's the neck. And most patients honestly have a little bit of both. There's another video that we did. It's called Brain versus Strain. You can go take a look at it. We talked about a research paper showing how that mild traumatic brain injuries and neck injuries produce almost indistinguishable symptoms, meaning that they look the same. So finding a doctor that knows how to identify the source of your headache pain is the best place to start. So what do you look for? Well, you look for somebody who's got the education, the training, the experience, and the skill to do that. And you also want to take a look at some of their reviews and see if they've had a good track record of doing this. So let's jump in very briefly and take a look at the different places that you can begin. So first of all, you need to understand that there are some headache symptoms that are considered to be red flags. Red flags are symptoms that are ominous, that you need to be seen urgently. You need to go to an emergency department. Something such as like a thunderclap headache, which is like an explosion of pain inside your head. If you have loss of vision, if you have tingling and numbness on one side of your face, one side of your body, if you feel like you're going to drop to one side, if your feet are all of a sudden clumsy, if you have difficulty swallowing, if you have difficulty speaking, if you have vomiting, if you're passing out, all of those things are very, very sinister signs. Most people sort of understand that and know to go to the emergency department. You don't go get a massage, right? So, but outside of those, where do you begin? Well, a very common place for patients to go is the primary care doctor, and that can be an adequate place to begin. Once again, you have to remember that the individual provider that you see there, they need to have the training and the education to know how to triage and know what kind of headache that you have. You don't necessarily want to see somebody that doesn't have that training. So while primary care can be a great first place to start, and it's also not a bad place to start because you can be screened for some of the red flags of pathology. You can even get some medication that can kind of help co-manage your symptoms. So that is option number one. Option number two is seeing a trauma credentialed and a trauma trained chiropractor. Now, not all chiropractors are the same. I myself am a chiropractor, and I can tell you firsthand after having postgraduate training, I wouldn't want any of my family to see anybody who didn't know how to screen out for the different headaches and know how to work up the different tissues that can be damaged. Once again, you need to be able to rule out whether it's something from the head, something from the neck, or if it's a little bit of both. And you also need to know if there's any sort of compression of structures in and around the spine. A trauma-trained and a trauma-credentialed chiropractor can order appropriate imaging, including advanced imaging such as MRI. They can make referrals to other medical specialists such as neurology, or if it's a really severe injury, sometimes they need to go see a surgeon. So a really good trauma-trained chiropractor can do that. Alternatively, another option is somebody who is a neurologist. We mentioned that you can get a referral there, and for certain conditions, a neurologist is a really good idea. However, most injuries in car accidents involve the musculoskeletal system with some impact to the central nervous system or some impact to the brain. And so for musculoskeletal conditions that continue to be painful for long periods of time, seeing a physiatrist or a physical medicine and rehabilitation doctor that can do some injections, that can order stronger medications is also not a bad way to go. Last but not least, you can even do pain management. Now, pain management is usually a provider that's reserved for patients that have exhausted all other forms of care, that there's really nothing else that can be done. All the diagnoses have been found, and in spite of all reasonable treatment, these patients still continue to hurt. So, bringing this all full circle, what is the best thing to do if you have headaches following a motor vehicle crash? Well, first things first, make sure you don't have any red flags. If you do, immediately go to an emergency department, go to urgent care. However, outside of that, starting with a visit to a trauma credentialed and a trauma-trained chiropractor is a decent first step, as is possibly even going and seeing your primary care provider. At some point, a really good trauma-trained chiropractor would probably recommend you see your primary care doctor anyway, just to get some simple medications and to get some medical co-management. They understand your condition if you've got a relationship built with them over the years, and they can really help you moving forward. I hope you found this video helpful. I hope you found it informational in your search and in your journey to try to get these headaches under control that you may be having. If you live in the Minneapolis or St. Paul area, we are here to help. I hope that you found this video informational in a way that it changes not only your life, but somebody else's life. You have many videos to pick from, and I'm honored that you chose this one to listen to. And until we meet again, have a blessed day.